When we think of the ancient world, we often picture grand temples, wise philosophers, elegant queens, and powerful empires. But beneath all that glory, hidden behind the marble statues and golden crowns, there was another reality, one that didn't make it into the history books. Long before modern medicine, people still suffered from the same sharp, unbearable pain that can bring anyone to their knees: toothaches. And in a time without dentists as we know them today, the way people tried to deal with that pain was anything but gentle. In this episode, we step back into a time when oral health meant something very different from what it does today. Welcome to the ancient dentistry nightmares. Imagine sitting in a hot, dusty room thousands of years ago, your jaw aching, your gums swollen, and having no idea what was really happening inside your mouth. No painkillers, no clean tools, just someone leaning over you with crushed plants, sharp needles, and a mixture of honey and resin that was about to be shoved into a hole in your tooth. Welcome to ancient Egypt, where dental care existed, but understanding infection, bacteria, or even nerves did not. And yet, even without modern science, the Egyptians tried their best to save teeth. They were doing what they could do with what they had, and what they had was wild. Let's start with fillings. Yes, tooth fillings. The ancient Egyptians knew how to plug holes in teeth, and they used whatever they thought might work: resin from trees, sesame seeds, yellow ochre, barley, and even honey. Honey might sound pleasant, but in an infected tooth, it meant sealing bacteria inside. And let's not forget, these ingredients weren't applied in sterile rooms or with sanitized gloves. They were mixed by hand, stored in clay pots, and packed into diseased mouths with tools made of bronze or bone. Sometimes they even used strips of linen soaked in herbal mixtures, maybe fig juice or cedar oil, and jammed them into cavities. These fillings were about stopping the pain, blocking the air, and hoping for the best. But can you imagine how that felt? No numbing, no precision, just raw pain and a stranger's hands in your mouth. And it didn't stop there. If the pain didn't go away, if a tooth felt loose or swollen, there were other methods. Some used plant bulbs mashed into pastes to rub on aching gums. Others believed pricking the gum or tooth with sharp metal needles could release the pain. Think about that, inserting needles into inflamed gums and broken teeth. Without understanding why the pain existed, they tried to attack it directly by poking it. It sounds brutal, doesn't it? But here's the worst part. They didn't know about infection. They didn't know that sealing off rot with sweet, sticky honey could make things worse. They didn't realize that driving a needle into the pulp of a tooth could spread bacteria deeper. There were no antibiotics, no rinses, no dental chairs with bright lights. Just trial, error, and a lot of pain. Still, the Egyptians were advanced for their time. They even had dentists, not just healers or priests, but specialists who treated dental issues. Records from ancient papyri described detailed treatments for loose teeth, swollen gums, and tooth decay. Some of their methods, like combining honey with antiseptic herbs, weren't entirely off base, but the understanding of cause and effect was missing. They didn't know why something worked, only that it sometimes did, and if it didn't, the pain continued, or the tooth was pulled. And when pulling didn't help, sometimes surgery came next. Primitive incisions, cutting out infected gums, draining abscesses. It was dentistry without anesthesia, without microscopes, and of course, without gloves. A fight against pain using tools closer to kitchen utensils than surgical instruments. Archaeologists have uncovered skulls with teeth bound together by gold or silver wire. Lost molars are tied back into place using neighboring teeth like anchors. Were these done while the patient was alive, or part of a burial ritual to make the dead look whole? We may never know. But what we do know is that these metal bands had to be tightened, meaning pressure, force, and likely unimaginable pain. So next time you complain about the dentist's drill or the taste of mouthwash, remember this. In ancient Egypt, your toothache might have been treated with tree sap, raw linen, a metal hook, and a prayer. All of this feels like something out of a nightmare, and we've only just begun. Like the Egyptians, the Etruscans lived long before modern medicine, yet they were already trying to fix broken smiles in ways that still leave us wide-eyed today. But what they came up with wasn't just clever, it was disturbing. Beautiful on the outside, yes, but underneath was a mix of metal, pain, and mystery that makes you thankful for today's dental chairs. The Etruscans, a powerful ancient people from central Italy, were some of the first to experiment with dental bridges, and not the kind you'd recognize from your local clinic. Their bridges were made from real human or animal teeth, held in place with strips of gold that were bent, twisted, and soldered directly onto the remaining teeth in a person's mouth. That's right, real teeth bound by precious metal inside a living mouth. To modern eyes, it might even seem artistic. These were crafted by goldsmiths, not doctors. Imagine sitting in pain, missing a front tooth, and someone offers to restore your smile with a gleaming golden band laced through a borrowed tooth and anchored to the one still hanging on in your mouth. What's worse, we know that these early bridges weren't very stable. They might have looked impressive at a banquet, sparkling when someone smiled, but they couldn't handle chewing. They were fragile. Some teeth were even too big or didn't fit properly. But instead of waiting for better solutions, the Etruscans pushed forward. Gold wire was wrapped around teeth, even if they were already loose or diseased, and that just made things worse. Any guess what happened when one of those teeth gave out? Well, of course, infection. And yet these were elite women, the ones most often found with these devices, so you can imagine the pressure. Status, beauty, the appearance of health. Could it be that they had teeth removed on purpose just to fit in replacements? That's what many scholars believe. This wasn't always about fixing damage. It may have been part of a ritual, a cosmetic or symbolic sacrifice. Imagine having a healthy tooth pulled out not because it was bad, but because fashion demanded it. It happened, and in a time without antibiotics, without even knowing what bacteria was, it was dangerous. Many of the teeth used in these devices were real, cut down, polished, and wedged into place. Others were carved from ivory or bone. Either way, the mouth became a battlefield. The bridges were pulled tight to keep things in place, putting pressure on surrounding teeth and jawbones. Over time, this tension could damage even healthy teeth, causing even more loss and, ironically, the need for more replacements. Even though gold doesn't rust or rot, the mouths they lived in certainly did. Oral infections spread fast. Gums would swell, roots would ache, and a single bad tooth could lead to serious illness or even death. But back then, pain wasn't a warning sign, it was expected and normal. Still, you have to admire the effort. These were some of the most advanced dental prosthetics of the ancient world. Technically impressive, yes, but safe? Not even close. However, if you were shocked by the methods of the ancient Egyptians and Etruscans, wait to hear what the Romans were swishing around in their mouths every morning, because their secret to white teeth wasn't mint, baking soda, or charcoal. It was urine. Yes, human urine. Bottled, traded, taxed, and even imported. And the best kind, according to the Romans, it came from Portugal, because it was believed to be stronger, more potent, and more effective at whitening teeth. Sounds outrageous? That's only the beginning. The Romans weren't using urine just for fun or out of superstition. When urine is left to sit in the open, it turns stale and breaks down into ammonia, a powerful cleaning agent still used in some household products today. The Romans figured this out, not scientifically, but through observation. They noticed that urine could clean fabrics, bleach wool, tan leather, and apparently polish teeth. So they gargled it, swished it, and mixed it with pumice, and rubbed it directly onto their gums. The goal was a dazzling white smile that glowed at public banquets and in the forums of Rome. And it worked to some degree. Ammonia does have whitening properties, and in theory it could help remove surface stains. But the idea of swirling a warm cup of fermented body waste in your mouth day after day makes you wonder, what did they smell like? What did they taste during breakfast? Could you eat olives after that and still enjoy them? This wasn't some hidden practice either. Urine was so valuable to the Roman economy that emperors like Nero and Vespasian actually taxed it. There were public urinals designed not just for convenience, but to collect the liquid gold for industries, including textile processing and dental hygiene. Imagine public bathrooms with jars of urine being scooped and sold, and some of it was heading straight into someone's mouth. But that's just the toothpaste. When it came to actual dental procedures, things took an even darker turn. Toothaches were as common then as they are now, maybe even more. With all the stress, grit, and lack of clean water, and Roman dentists didn't exactly have gentle hands or sterile clinics. When a tooth hurt too much to bear, there was one main solution: extraction. And it wasn't done in a reclining chair under soft music, just a sharp, hooked piece of bone or metal, and a lot of screaming. Roman dentists used forceps, often carved from animal bone or cast in bronze, to grip the offending tooth and pull. But the procedure was more than just painful. It was risky. Pulling a tooth from the top jaw could damage the eye sockets. Tug too hard and you break the root, or worse, shatter part of the jaw. That's why Roman writers like Celsus gave detailed advice. Slice the gums first, expose the root, wiggle the tooth loose, and if things got too messy, burn the wound with a hot iron. Then cover it in honey and wash with mead, as if sweetness could somehow heal a burnt, bleeding mouth. Despite all this, Roman teeth, at least in some parts of the empire, weren't in terrible shape. Archaeologists studying remains from places like Pompeii and Herculaneum found surprisingly low levels of cavities. But what they did find was plenty of tartar, gum disease, and in many cases, stress-related enamel damage, especially in children. Whether rich or poor, life was hard, and it showed in their mouths. Unlike the ancient Romans, the Greeks didn't rely on urine to clean their teeth, but that doesn't mean their dental methods were any less alarming. In fact, when it came to fillings, the ancient Greeks made a bold and deadly choice. They used lead, the heavy metal we now know to be dangerously toxic, which was packed into decayed teeth in an attempt to stop the pain and restore function. And they had no idea that while they were fixing one problem, they were quietly creating another, poisoning their own bodies. But before we dive into that nightmare, let's talk about what the Greeks thought caused toothaches in the first place. Their entire medical system was built on the idea of balance. 4 fluids, or humours, that had to stay in harmony: blood, phlegm, black bile, and yellow bile. When something hurt, it meant something inside had gone out of balance. A bad tooth? That might just mean too much heat or dryness, or too much cold and wet. Not infection, not decay, just misbehaving fluids. So instead of attacking the root of the problem, their treatments focused on calming the body, soothing the pain, and hoping the fluids would find their way back into balance. So what did that look like in practice? For starters, if you had a cavity, you wouldn't necessarily have your tooth pulled right away. In many cases, they would try to save it. They'd clean the hole, usually without anything remotely sterile, and fill it in with a variety of materials. Among the worst was lead. It was soft, easy to mold, and readily available. But it also had no business being in a human mouth. Over time, as the metal sat in the tooth, tiny particles would be swallowed, absorbed, and slowly build up in the body. Lead poisoning causes everything from stomach pain and fatigue to brain damage, and all the while patients thought they were being healed. Sometimes, instead of fillings, Greeks would try to soothe the pain with herbal poultices, plant-based remedies pressed into the gums or stuffed into open cavities. Linen soaked in medicine was a common method too. It sounds almost comforting until you imagine what the cloth was soaked in. Strange herbal brews, burnt bone powder, or concoctions with ingredients like vinegar, pepper, or even ground oyster shell, all incredibly abrasive and likely painful against exposed nerves. Still, there were moments of brilliance. Famous thinkers like Hippocrates and Aristotle wrote about dentistry, making careful notes on tooth development, decay, and gum disease. They even recommended using metal wires to stabilize wobbly teeth or fractured jaws, essentially early orthodontics. But their understanding of anatomy was limited, and when things got really bad, extraction was often the only answer. That meant bone forceps, a firm grip, and a lot of luck. And make no mistake, Greek dental tools may have been primitive, but they were serious, sharp, cold, and unforgiving. These instruments were designed to grab and pull, not to comfort. And extraction was a brutal experience done without painkillers, often ending in bleeding, swelling, and possibly infection. But if you thought waiting it out was the better option, think again. A rotting tooth could fester for weeks, the pain spreading to the jaw, the eye, and even the brain. The worst part, the Greeks didn't just struggle with the pain, they misunderstood it entirely. They had no idea what bacteria were, so while the Greeks gave us philosophy, democracy, and the first steps toward modern medicine, they also gave us the earliest dental fillings made of poison. And in their case, a painful smile was deadly. Babylonians didn't have dentists. They didn't have drills, fillings, or even an understanding of what a tooth really was. But they had pain, sharp, pounding, relentless toothaches that could ruin sleep, steal strength, and drive even the calmest person to the edge. And to fight back against this invisible agony, they turned not to medicine, but to magic. If your tooth ached in ancient Babylon, the most trusted treatment might not have been herbs or tools, but a small clay tablet. Not something to chew or swallow, something to pray over. These were magic tiles, tiny pieces of clay inscribed with incantations, sacred words meant to battle the cause of pain. The Babylonians believed that toothaches were caused by little creatures burrowing deep into the gums, tiny evil worms that gnawed at the insides of teeth, feeding on pain and bringing rot with them. The idea wasn't just a local superstition, it was shared across much of the ancient world. From Mesopotamia to Egypt, even into medieval Europe, the belief in tooth worms lingered for thousands of years, but Babylon may have been where it all began. Their solution was a blend of prayer, ritual, and physical action. First came the incantations. These weren't short, whispered charms, they were long, poetic appeals to the gods, especially a deity associated with wisdom and healing. Some spells called upon the gods to smite the worm directly. Others offered drinks like beer and oil to coax the creature out gently. One famous line from a Babylonian spell goes, "Lift me up and let me dwell between the teeth and the jaws," a terrifying image of the worm speaking, announcing its hideous presence from within the mouth. But saying the words wasn't enough. The spell had to be written on clay. The tablet was then placed directly onto the cheek, just outside the aching tooth, like a bandage made of magic. Can you imagine that? Walking around with a prayer tile stuck to your face, hoping the spirit inside your tooth would read it and leave. Other rituals added layers of complexity. The spell might be recited over a bowl filled with beer, malt, and oil, a kind of magical mouthwash that probably stung as much as it soothed. In some cases, a special cloth, known as a parsagu, would be wrapped around the head, tied tightly over the temples. Maybe this helped ease the fever. Maybe it simply kept the ritual in place, but it looked more like a head wrap from a bad dream than any kind of healing. And yet, this was serious business. Pain wasn't just a physical problem, it was a spiritual one. People believed that the tooth worm was alive, thinking, malicious. You couldn't just numb it or pull it out, you had to reason with it, threaten it, trap it, or beg the gods to destroy it. If the pain didn't stop, maybe the spell had been spoken wrong, maybe the tile hadn't been placed in the right spot, or maybe the worm had won. Even now, it's hard not to feel a strange chill when reading those ancient spells, because behind the magic and superstition, real people were suffering just like we do today when pain takes over. But without our knowledge, without our tools, and all they had was clay, fire, and faith. So next time you're dreading a trip to the dentist, take a deep breath, lean back, and be grateful that no one's about to scrub your teeth with crushed bones. Grateful you won't be rinsing with fermented urine, and especially grateful no one thinks there's a tiny worm living inside your molar. Because whatever that buzzing drill might sound like, it's a dream compared to gold wire bridges, spells carved into clay, or lead jammed into a rotting tooth. You were born in the age of anesthesia, clean tools, and numbing gel that actually works. That alone deserves a big smile. So go ahead, book that checkup, brush your teeth, and thank your lucky stars you don't live in a time when dental care came with prayers and pain.